guys, I'm going to tell you a little bit about Wilm's tumor today. So Wilm's tumor is also called Nephroblastoma. So what is it? It is a rare kidney tumor. So this is embryonal and it arises from the undifferentiated mesoderm. So out of 1 million people that are aged 1 to 14 years old, only about 7.8 cases occur. It accounts for about 5% of the children cancers in the United States. And so there's about 500 kids per year who are affected, mostly between the ages of 1 to 5. But mostly this occurs between 2 to 3 years old specifically. And it is slightly more common in black children than white children. This is the most common solid tumor in kids, and if the mother was exposed to toxins before conceiving the child, then that child has an increased risk of developing Wilm's tumor. So the pathophysiology behind this condition is there's two different kinds of origins. There's a sporadic origin and an inherited origin. If the origin is sporadic, then that means that the child does not have a genetic predisposition to it. If the origin is inherited, that's more rare, but it is transmitted through autosomal dominant methods. So then it's suggested that there is a mutation of multiple tumor suppressor genes that then cause this disease. So then 18% of kids have the congenital anomalies as well as the enlarged tumor mass on their kidney. So these anomalies could include aniridia, which would be a lack of an iris in the eye. So as you can see here, this child doesn't really have a colored part of their eye. Hemihypertrophy, so an asymmetrical body, which as you can see here, that looks kind of like that. And then genitourinary malformations could be various different kinds of malformations. So you could have a horseshoe kidney, as seen in that bottom right picture. I also, in the top right, I showed some polycystic kidneys up there. And then, but kids who have these congenital anomalies and the nephroblastoma are more likely to have the inherited bilateral form of the condition. So for clinical manifestations, most kids find that, well, not necessarily the kids find, more so the parents find, but there's an enlarged abdominal mass before they hit the age of 5 years old. So oftentimes these kids will appear healthy and just like they're doing fine, they may be asymptomatic, but the parents may be, most of the time it occurs, well, not necessarily most, but a lot of the times it might occur when the parent is dressing or bathing the child and then they find this abdominal mass. Other complaints may include vague abdominal pain, hematuria, anemia, fever, and possibly hypertension from the excess renin secretion by the tumor. So as you can see here, again, we're going to refer back to this system here with the renin, again, causing the hypertension. So then other clinical manifestations, this may occur in any part of the kidney, and upon diagnosis, the sizes may vary greatly. So basically, it is a solid mass that's surrounded by a smooth, fibrous external capsule, and it may contain cystic or hemorrhagic areas. And the tumor is generally separated from the renal parenchyma by a pseudocapsule. Upon evaluation, so we're going to do a physical examination, and we may then find that the tumor is firm, non-tender, smooth, and generally on one side of the abdomen. So this picture down in the bottom left hand over here shows a physical examination, more so on an adult than on a child, but basically the same idea. It would be on a child most likely. If this is palpable, if the tumor is palpable past the midline of the abdomen, it may either be large or it may be arising from possibly a horseshoe or ectopic kidney. So this is a horseshoe kidney right here and then an ectopic kidney right there. Once that abdominal mass is detected, though, we want to do some diagnostic imaging to confirm that there is a solid infrarenal mass. Diagnosis would be based on a surgical biopsy, and then you're also going to do some additional labs and radiology to evaluate whether metastasis is occurring. The most common sites of metastasis are going to be your regional lymph nodes and your lungs, and the less common sites would be the liver, the brain, and the bone. So there's some pictures of those kind of areas. As far as treatment is concerned, there are several stages that the condition could present with. So it could be stage 1, 2, 3, 4, or possibly 5, which goes off of the most widely accepted version by the National Wilm's Tumor Study Group, which I put on the next slide. Primary treatment would be surgical exploration and resection, as you can see here, cutting open that kidney, taking out the mass part, and then closing up the kidney again. Or you can do chemotherapy and then surgical resection, which for kids with higher stages, radiation therapy can be used as well. For a localized disease, the survival rate is up to greater than 90%, and for higher stages, it can be up to 80%. So here's that stage. If you want to take a look, pause, and figure out, just see what stage is associated with which characteristics, and then treatment can be based off of that. These are my references, and I hope you guys learned a little bit about Wilm's tumor. Thank you.